Good evening, Norris. This is Jody. How can I support you today?
So I wanted to use a little bit of fentanyl in smoking.
This is NORS, or the National Overdose Response Service.
I'm here with CBC now, okay? You okay with going on speaker with me?
Yeah, that's okay.
Okay, awesome. Give me 1 second, okay?
People call this anonymous hotline when they're about to use drugs like fentanyl.
Okay, you go ahead. You get started. Enjoy.
And operators like Jody will listen for signs of an overdose.
Okay.
How's it hitting? Hitting good?
Yeah.
This is her first call tonight. She'll send EMS if she suspects something is wrong.
I feel like it's a little bit stronger, so I thought I'd better call just to be sure.
It's scary. It's scary because are they okay? Are they okay? That is what is hard in the head sometimes. So as you know, I'm gonna sit with you for at least 15 to 20 minutes, make sure that you're good, okay?
CBC News got exclusive access to NORS and some of their calls.
I'm so glad that you called in tonight.
It's not about stopping drug use, but keeping people alive. Here's another caller.
You don't want to tell your family, but you also don't want to be alone.
Yeah, for sure.
Kind of embarrassing.
Most overdose deaths happen when someone uses alone.
Do you have any plans for this evening?
And surprisingly, callers are not who you might think they are.
Maybe some homework, like counseling and stuff for criminology.
Oh, nice, nice.
You've got like athletes, you have bankers, you have people from the military that are calling in. These aren't usually the people we think of that use drugs, right? But they are.
It is a wide variety of people who are in school, in college, getting their masters.
These are not folks experiencing homelessness. These are folks with jobs. And
Both Kim Ritchie and Jody are former drug users.
the highest rates of overdose, to be honest with you, in Canada are men ages 16 to 60 that work in trades.
I heard that there was a bad batch going around in my area.
What are you using?
That
Most of the calls come from Ontario, then Alberta, BC, and Saskatchewan. The hotline is trying to get at that large group of people that wouldn't use a safe injection site and is trying to keep their drug use hidden.
Still doing okay from that choke? Do you think you're gonna do another one with me?
No, I don't think I need to do another one. I need to concentrate on my work.
Oh, for sure.
With money from Health Canada, they've answered almost 20,000 calls and responded to over 200 overdoses. 0 deaths.
Norris called me when I was in the middle of working, saying Faith is unresponsive in the basement.
Tamara O'Toole's daughter, Faith, has overdosed at least 3 times on the line.
Overdosing sucks, but the hotline was really useful, you know, because like you can get help. They're like babysitters, you know.
Tamara let Faith live and use at home, but insisted she call NORS.
Before, when she didn't call, I was worried constantly. Every 4 or 5 hours, I know she's going to use, and then I'd be messaging her. Hey, you okay? You okay? You okay? Oh, please message me. Let me know you're okay. Like panicking. I mean, of course I don't want my child to use drugs. Nobody does. But if they're going to, and I can't make her stop, what can I do to help keep her as safe as possible?
This one, here we go. So this is actually, I think, the first one. So there's Rebecca and me. And,
Kim helped start the hotline with her friend Rebecca Morris Miller during the pandemic.
and this is like the first time our work really went like wide, you know?
The two met in Narcotics Anonymous.
God, we were so cute.
When everyone was stuck at home, overdose deaths surged.
It was small. We didn't have payment. We were working other jobs, trying to make this thing just come together and like learning how to build something.
The hotline started in 2020. Rebecca had $1,000 and a cell phone. I'm in Owen Sound to meet her sister, who took it over after Rebecca died from an overdose.
She always said her drug of choice was fentanyl, so if that's your drug of choice, it's a hard road, very, very dangerous road.
Lisa Morris Miller says shame stopped Rebecca from calling the hotline the night she died.
How do you cope with that? Like knowing that she created a service to make sure that people don't use alone, but then for herself to not have used with someone?
I don't know that I do cope with it. Honestly, like I don't know what that looks like. I know that Becky was so innerly unsettled through her lifetime. And The only way I cope is by knowing that, hoping that at this stage of her journey that she's at peace.
In memory of her sister, Lisa has helped Noors grow.
So we've got the emotional dumpster fire. This is probably our most popular shirt.
Even Rebecca's son Errol helps by making swag.
It's one of the things that better helped me move on from the death.
And so Team Noors is on a mission to challenge the idea of who is using drugs,
So I just dropped you off some bags. There's something to lock, so.
especially as drug use becomes more widespread, more unpredictable.
The kid at 16 that is popping perks off the street because he twisted his ankle in soccer a year ago and can't get his OxyScript anymore is not looking to die. They got a bad batch of oxys. Just gonna drop some stuff off here to our good friend Lance, who gets this stuff out into the community.
They aren't so focused on stopping drug use, just making it less harmful.
We just want to make sure that we're giving access to everybody that we can for the service, because we just really don't want people using alone.
There's a lot of people that talk about harm reduction and say that it only continues that cycle of drug use. What do you say to that?
I'm not here to judge anybody on their path. I certainly don't think that it initiates or continues substance use. It's that inner pull that is very, 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 very challenging to step away from.
A lot of overdose prevention programs serve a different demographic.
So this is the George Spady. It's a physical supervised consumption service site that supports people who are using substances alone.
And it's usually men who go to these sites.
It's a very different demographic that we're seeing using the line. Most of them are stably housed. All of them are still highly vulnerable.
Dr. Monty Ghosh says the majority of callers are female or transgender people.
They prefer to go to these lines for a variety of reasons, one of which is stigma, one of which is safety.
And 10% of all calls ask about recovery.
They form that alliance, if you may, which gets them comfortable to seeking help and entering recovery. So it's a key intervention from that lens to help build trust, help build confidence, help build comfort in seeking supports.
I love this one. Little peanut face. They're so cute.
Tamara is terrified she will lose her daughter before she gets into recovery.
Joyful.
Faith isn't living at home anymore, so she doesn't call Noors as often.
Do you want to stop using drugs? Yeah, I guess that's the goal.
These were the busy, good times.
Tamara hopes that's true.
I'd love her to be at home where she's safer and loved. Of course, I'd love her to go back to school and entering recovery, whatever recovery looks like for her. But what do I know? You know, I'm just the mom.
Good evening, Noors. This is Jody. How can I support you?
Here's another caller. He's just finished work for the day.
What are you using on the line with me?
Crack.
Crack. Did you get it tested?
No.
No, not tested. Okay. All right, just do me a favor. Just start low, go slow, okay?
How do you know Noors is working?
Oh, I love this question because people are calling and they're not dying. It's really that simple.
It hasn't felt any different than normal.
Okay.
I feel pretty safe.
Yeah, awesome.
Each call a chance to try and keep people alive.
I was on the streets for a few years. Like, I'm not ashamed of my past, but it's just because I bring myself back to how lonely it was. That's why I'm so happy being here at Noors too, because no one has to feel alone while they use, right?
All right, thank you very much for this.
Okay, no problem.
Have a good night.
Bye.